We are back with today's checklist. Fall means comfy sweaters and cozy drinks, but it also means we are on alert for flu, COVID, and RSV. So we have some good news for you this morning. Free at-home COVID tests will be available again starting next week. NBC News medical contributor Dr. Natalie Azar is here to walk us through all of the vaccines and boosters out there. Good morning.
Good morning.
I got my free COVID test yesterday. I just walked in. They have it anyway. The pharmacies have it now.
Have a stash of them.
Yeah. So let's start with the flu vaccine. Let's talk about it. Who needs to get it? When should they get it? All this stuff.
Okay. So everybody, with a few exceptions, over the age of 6 months is eligible to get the flu shot. We usually recommend to get it by the end of October. It takes about 2 weeks for those protective antibodies to kick in. That's what you have to keep in mind. Flu season is starting about now and heads into the winter. If you're 65 and older, there's a couple high-dose shots that you are eligible for. But the rest of us, in sort of that middle bell curve, it doesn't matter which one you get because there's a lot of different flu shots out there.
Speaking of that, what about the nasal spray?
Right.
Is that
so
better or worse?
Nasal spray, you know, every couple of years we find out, oh, maybe it doesn't work as well as the injectable one, but it is available this year, and it is a great option for little kids who are needle phobic. It is indicated for people between the ages of 2 and 49. But here's the thing. There are a couple of exceptions to it. It is a live vaccine. Kids between 2 and 17 who are taking aspirin and other certain medications are not meant to get it. People with weakened immune systems, pregnant people, and there's a few other on that list. So if you're thinking about getting the nasal spray, check with your doc first, just to make sure.
Is it as effective?
Yeah.
It is? Okay.
It is.
Let's talk about RSV for a moment here, because we know the FDA just approved that first ever RSV vaccine, and infants and toddlers, if I'm not mistaken, they're especially susceptible to it. But should adults also get the vaccine?
Be getting the vaccine. So for little ones, this is great. We have approved now something called a monoclonal antibody for little neonates and infants born in their first RSV season. But for individuals 60 and older, there are now 2 different RSV vaccines that are available. Should everybody be getting it? Not necessarily. We are, yes, talking about older adults, people with chronic heart or lung disease, people with weakened immune systems, people living in nursing homes or long-term care facilities. Now, a lot of people say, well, can I get the RSV shot with the flu shot? If you absolutely must, probably yes, but the CDC has some data that maybe the flu shot won't be as effective if you get it with the RSV. So I'm going to make a recommendation to my patients to separate RSV from flu shots.
It's not for kids.
No, this is for 60 and up. The little ones get something called a monoclonal antibody. They were approved around the same time. It's really great news still.
Great.
All right. Are there potential side effects that you need to worry about?
So with the RSV vaccine, like a lot of vaccines, we always talk about those injection site reactions, right? You get pain, redness, soreness, and then the usual with any vaccine: fatigue, fever, headache, nausea, diarrhea. Who would ever get this thing? It's typical, guys. This is your immune system working. Muscle joint pain. There can be some neurological events that there are reporting, and again, probably not a good idea to take it with the flu shot this year.
What about the COVID
booster? So we have a COVID booster this year, and we're probably going to stop calling it booster. We're going to say an updated vaccine, just like we update the flu shot every year. This is targeting the XBB strain that was prominent in spring and summer, but it is going to cover the current circulating strains, which are different than that one. And it is okay to get the COVID and the flu shot at the same time. We've been saying that for a couple of years. Go ahead.
Is there a logic? So I just got my flu shot. You know, I was scared, but I did it, right? Just
You're always scared.
I know. I always need. I'm the same, but I suck it up and I get it done. But for some reason, with the COVID booster, a lot of people are like, do you know what I mean? Should we apply the same logic that it's just an updated?
So for the CDC and communication, yes. For an individual, there are so much nuance to this. And I think I would just say that the booster, an updated shot of the COVID shot, gives you protection against infection for a number of months, and then that declines. Protection against severe disease is more durable than the flu vaccine. So if you've been boosted with COVID before, if you've had a COVID infection, you are still protected against severe disease. So if you're in that bell curve, young adult, otherwise reasonably healthy, talk to your doctor about getting an updated shot. Again, from a public health population perspective, the answer is kind of yes.
Yeah. So whether you've had it or the
vaccine.
there's
a lot of nuance.
Right.
You're so good.
Talk to your doctor.
Thank you. Seriously, really good. All right. For more information on current vaccines, go to today.com/health.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.